MedShield, embracing our members in good health since 1968. SMS MedShield to 33023 or talk to your broker to get your kind of care.
Some people may argue that condom distribution is a misguided solution due to the fact that it influences sexual behavior.
We already know about sex. We are doing it as teenagers anyway. So the government is trying to protect us in order for us not to get pregnant, not to get STIs, not to get HIV positive. So the government is just trying to protect us.
It's us actually that's exposed to this sexual things that are going on. So anyway, yeah, it's good that the condoms are being distributed. They're helping a lot of people, and I can see the decrease in pregnancy and all.
A lot of people are dying of AIDS, and they don't see it happening in society. So society needs to be broader. They should know about this thing, and it should be viral. People should have an understanding why they're giving condoms. It's not just to go to use it, but also to educate them to say stay away from unsafe sex.
So what do you think when you hear the term harm reduction? Well, originally, harm reduction was a concept developed in response to the HIV/AIDS crisis in the 1980s. As you've just heard, condom distribution is a way of reducing the harm of getting infected with the HIV virus. However, harm reduction applies to many other facets of our health and not just communicable diseases such as HIV and STIs. So how can the principle of harm reduction be applied to the food that we eat, alcohol and substance abuse that is slowly destroying the lives of so many young people in societies, tobacco smoking that is killing so many people? Well, that is the subject of today's show, harm reduction. We have an expert panel that will help us tackle all these questions on harm reduction. And this panel is comprised of the Director of Nutrition from the National Department of Health, the Deputy Director of Non-Communicable Diseases, also from the National Department of Health, the Executive Director of the National Council Against Smoking, and we also have founder and president of an organization called ARA, or Africa Harm Reduction Alliance. And from our Cape Town studio, we'll be joined by the manager of projects, policy and advocacy and human rights from an organization called PWUD, or simply put, People Who Use Drugs. Now, you may want to be part of this show by asking the panel some questions or simply just sharing your views with us. In that case, the number to call is 011-714-6918 or 6919. You can also tweet us at SABC Health Talk or simply just interact with us on our Facebook page, SABC Health Talk. So sit back, relax, and learn from this exciting show coming to you just after a short break. I'm Dr. Seloma Daung, and this is Health Talk.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
I feel it's a real person.
And it's nutritious and delicious.
It's good. I really like it.
This celebrates being South African. We love our beer, we love our food, we love our music.
For knowing who you are going, you must know where you come from.
I'm excited to be part of this year.
For all your travel trends, catch us every Sunday, 12 midday on Channel 404.
All right, so let's learn more about what this harm reduction is, and from our guests who are really having a great time here in the studio. First up is Dr. Khosile Tlhapi. I think a lot of you will know him as the president of the Health Professions Council of South Africa, but That's not why he's here today. He's here as the founder and president of, co-founder rather, and president of an organization called ARA, Africa Harm Reduction Alliance. I'll get it right. Eh?
No, you'll get it right.
Welcome to Health Talk once again.
Thank you, and good morning to the viewers.
All right. And next to Dr. Letlape, we have Itumeleng Setlare. Itumeleng is the Deputy Director of Non-Communicable Diseases from the National Department of Health. Welcome to Health Talk.
Thank you, and good morning to the viewers at home.
All right. Perhaps let's start with you, Dr. Letlape. You know, I don't think a lot of people are aware of what this term harm reduction or the concept harm reduction is. Can you perhaps just simplify it for us? What do we mean when we say harm reduction? I made the example of condoms, but
okay,
yeah.
Let's go to intravenous drug use.
Right.
Heroin addiction, for example, which is a very addictive substance which has harmful effects on the being, besides giving you a high. And we've recognized the difficulty of getting heroin addicts off heroin. And what has been created is an alternative to heroin that will give you the high without the harmful effects.
Right.
So methadone treatment has been created. So I think in health services, that's probably the oldest example of reducing harm, where you put people in institutions, counsel them, help them with their addiction, but give them substances so that they get a benefit with a lower profile of harm.
Yeah.
Ideally, most things that cause harm, some of them, you need to avoid them. But we need to accept that addiction is part of human personality, and that people that cannot quit things that are harmful to them, can you provide less harmful alternatives?
Yeah. Just tell us a bit about the history. I mean, is it a new concept? Why are we suddenly talking about it? Why was it not there before? I mean, these issues have been with us before, isn't it?
The issues have been with us before, but the International Harm Reduction Association was started about 1980 or so, where people recognize these issues, and we're doing it piecemeal. But if you look at it, Sello, we're both medical doctors, and what I've come to realize after 32 years in private practice and 35 years as a doctor is the fact that what we do as doctors is harm reduction. Because if you look at it, all our patients eventually die. So we have a 100% mortality rate, despite what we do.
Yeah.
But our quest is to ensure that we improve the quality of lives of people, and we reduce harm associated with living. Whether you have an illness like diabetes where there's no cure, we'll reduce the harm associated with diabetes. By treating you, we reduce complications, we improve the quality of life, and we prolong life, and we ensure that you have as long a lifespan as can be desired for your population.
Okay, before I get to Itumeleng, just tell us a little bit about this organization of yours, ARA, Africa Harm Reduction Alliance.
Well, I'm an ophthalmologist by profession, but because I've been involved in medical politics and have been concerned about the public and access to care for patients, and that patients be involved in their own care. In that period that I was in medical politics, in the Medical Association, in the World Medical Association, I was invited by the International Association of Patient Organizations. And what they began to say, the patient organizations, was that nothing for us without us. And you met a plethora of organizations where you had the affected people looking for recourse, looking for either a cure for a disease, management for a disease, or relief for their own relatives. And given our politics around HIV and AIDS, and having been a leader in the Medical Association, I got into the HIV debacle when we had a policy of no treatment. And what I've come to realize is that all our efforts around HIV and AIDS was about reducing harm and improving the quality of life. Whether it was about provision of antiretrovirals, whether it was about safer sexual practices, whether it was about education, so how people can protect themselves not to get infected, it was all about reducing harm. And what it all boils down to is the importance of health promotion and health education, which is what is lacking.
Right, talk about health promotion, and let me invite comment from Itumeleng Sihlare. Itumeleng, you're obviously Deputy Director in Non-Communicable Diseases. We're talking harm reduction. I mean, there's lots of harmful stuff out there that ultimately leads to non-communicable diseases. Can you give us a perspective from the departments, you know, what the views are, number one, and what policies are there to try and protect our people?
Okay, thank you. We are all aware that as a department we are having, or as the country, we are having the quadruple burden of diseases, and non-communicable diseases is one of those diseases that are currently a problem in our country. And as the department, we need to come up with ways and means of ensuring that we avert or we reduce the mortalities from this. And we also need to come up with ways and means of ensuring that we empower our people so that they can take informed decisions that will ensure that at the end of the day, their health improves. Because we cannot win this battle alone. The individuals, the families, the communities need to take a responsibility of their own health so that we can win this battle. Then one of the programs that we are coming up, as we are all aware that there are so many policies that the department has come up with. Currently there is one around sugar tax that is also, right. There is another one around the salt, we have tobacco legislations and so forth and so on. All those things are geared towards ensuring that we reduce the incidences and prevalences of the non-communicable diseases.
So apart from the regulations that we know about, you know, obviously the sugar tax and the issue around, you know, limiting the amount of salt in foodstuffs and so on, what else is the department doing? We earlier spoke around the issue of health promotion, education. What is the department doing in that regard?
Right. Currently, the department is engaged with campaigns. And I think most of the viewers will be aware that there are things like your Move for Health, where communities are encouraged to be active. You know, we also have programs like your promotion of food gardens. You know, we also have in our campaigns we also do the screening to ensure that, like what Dr. Tlhapi has said, it is important also again to identify these problems early so that the quality of life or life expectancy could be increased. Because if we detect them very late in life, that is a problem. The quality of life or the objective of trying to improve the quality of life is not going to be met. Then it is important for us to encourage our people to come or present themselves for screening, so that these problems could be identified early and interventions could be done in time to reduce the complications further in life.
Dr. Tlhapi, let's just put it into perspective, and perhaps for our viewers, if we could just talk about the types of this harm reduction. We spoke earlier about, you know, condom usage. I think you...
I think one thing that I would like to say to the public is that harm reduction says we as citizens can take responsibility for our own health. You know, he's talking about non-communicable diseases, but I'll give you a pertinent example about communicable diseases. I'm one of the ambassadors for hand washing. If you look at the issue of improved hygiene and the impact it would have on our health, just the simple act of hand washing is a harm reduction habit. Because when you do that, you spread the spreading of infection. You break that cycle of infection. And it's a simple thing, and it has to be a habit that's encouraged by all of us. And we need to create an enabling environment for hand washing when it is appropriate. Public toilets that have soap, that have water, that have paper towel, and even in our own homes, communities that have access to proper sanitation. So those are the issues. So it's about what we can do for ourselves in ensuring that we build a healthy nation. Your sexual habits. You know, there's an old saying, you are what you eat. You are what you ingest.
Well, talk about you are what you eat. Perhaps it's It's an opportune time for us to take a break. When we come back, we talk about the aspect of harm reduction in nutrition. Please stay with us.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
Reduce sauce by half. Reduce liquid by a quarter. It's a line that comes up in recipes frequently. But what does that mean? And how do you do it? How do you reduce harm in your food? Well, we took to the streets to ask the public how they reduce harm in their food.
I try to reduce the consumption. Let's say things like fizzy drinks, for instance. I consume more water, and then I take at least maybe once a week, because I know most of the healthy food is expensive. So one other best thing to do is to reduce to consume those that are not healthy. Yeah, that's another way of trying to balance between the two.
You need to cover your food when you're always cooking. Like, it's not necessary for it to be open while it's cooking. And don't add a lot of salt, because the food we already buy from the markets I think they have 30% of salt. So don't add too much spice, because spice can be allergic.
Basically, what I do with my food, I don't cook a lot with oil, because I believe in going organic and going green. I'm a healthy guy. I don't use a lot of salt in my food. Reason being, it's a high risk of, creating diseases. And I believe like sustaining my health and being active, I reduce like a lot of oil. Oil gives you like, high blood. It gives you like a lot of diseases. So I don't cook with oil. I use like, natural organic stuff like water and plants like that.
Yeah, very emotive subject, this about food. Okay, but anyway, we're going to let the expert talk to us about it. We're with Dr. Khosi Letlape, co-founder and president of ARA, Africa Harm Reduction Alliance. And we're now joined by Reboni Ntsiye. Reboni is the Director of Nutrition from the National Department of Health. Welcome to Health Talk, Reboni.
Thank you. Good morning.
All right. Well, maybe let's stay with you. You're Director of Nutrition, and we hear that the food that we eat can be harmful to us. How true is that?
It is possible that the food can be harm harmful depending on how they are manufactured, how they are processed, and how they are prepared, even at home during cooking. So there are a number of processes along the way, the food production line, which can cause result in harm, in making the food to be harmful to our health in particular.
Okay.
So it is really possible.
So what is your department then doing to try and protect the public from the harmful effect of whatever it is that comes with the food that we eat?
Okay. The issue of nutrition, or eventually people eating food, does not only result with the Department of Health. It's a long food chain which starts with production as well. Like I'm saying, from the Department of Agriculture, there are some agricultural methods that should be used to ensure that foods that are produced, they are not harmful. For instance, they do not contain a lot of pesticides or other substances that can cause harm, but those practices are observed. And then when coming to manufacturing, there are some regulations that are put in place to guide the food industry in ensuring that when they process the food or pack the food, then the food is not harmful. For example, there's a regulation for reduction of salt in processed food, so there are guidelines that are given so that the food that is produced or manufactured or processed does not contain high amounts of salt, which we know that salt, high amount of salt is associated with high blood pressure or what we call hypertension. There's also a regulations on for saturated fats, that there are some levels of saturated fats that should be also included in the food during processing, because that is associated with some of the heart diseases or coronary heart diseases. But furthermore, we also have developed a strategy for reduction, prevention and control of obesity for South Africa, which mainly look at number of issues. We have about 6 goals, because obesity and overweight is a huge problem in our country.
It is indeed,
Those who have just read or listened to our statistician general, Dr. Lohotla, when he released the 2016 South African Demographic Health Survey, one will realize that the rates of obesity have increased a lot, especially in women, is around 68% overweight than obesity combined, and obesity alone is about 41%, which is too high. And the worrying factor is that we also have an increase in childhood overweight and obesity. Although the increase has not it has not increased much from the previous surveys that were conducted, but it is of concern. If we check with the world global prevalence, we are almost, as South Africa, we are at 13%, which is almost double that of the global prevalence. So it is of concern to us. So in the obesity strategy that we have developed for the country, we are talking about of number of interventions that can be done, because one is not only, there are factors that are related to an individual, to household, and to the environment. One of those is to ensure that we make an environment conducive for one to be able to eat healthy foods that are not harmful to health. Obesity is of real concern because it's a risk factor for development of hypertension, diabetes, I mean, all those non-communicable diseases that we know of. So it is real of concern, and I will talk about interventions that we have come up with, that we have suggested.
Yes,
in
indeed,
the
and I'd like us
strategy.
to talk about sugar as well. But before that, and Dr. Tlapa, I'm going to come back to you in terms of whether or not this is people's ideas or whether or not the science behind, just to get your views on what we have. But before that, let's take Miriam on the line from Western. Miriam, welcome to Health Talk. Okay, Miriam will come back. Yeah. Can you just comment on the issue around, the science behind harm reduction?
Well, I think any policies around any particular aspect must be evidence-based.
Right.
Whether it's a policy on nutrition or a policy on sugar tax, a policy on drinking, a policy on smoking, it must be evidence-based. We can't do knee-jerk reactions. But secondly, we got to create an enabling environment. I mean, the latest thing that people talk about is social determinants. So you can talk left and walk right, you're not going to get a left result. So if you sit in an environment where what is readily available is unhealthy foodstuffs. When you open a fridge at home and all you see there is carbohydrate and sugar, no matter what you say, until you teach people about what should be in a fridge proportionately, you're not going to win. When you walk into a convenience store, if you stop at a garage and you walk into one of those stores, 95% of what is out there is sugar. It's unhealthy. So even if you wanted to make a healthy choice, it's not readily available. So this is where regulation and government and the industry should come to the party, where they make available healthy foodstuffs. And you heard on the inset somebody say, you want to eat healthy, but it's expensive. And this is where governments have a role to ensure that you can't have the cheap and nasty being the ones that are readily available. Why are we not talking about changing our staple food from starch to staple food that will enable us to be healthier beings? And people need to take responsibility, because intake is what you control as an individual. And people need to understand that you can adapt to anything. You can eat small amounts of food and be happy with it. But you can adapt to eating 3 times the amount, and when it is half that, you're not satisfied. But you can also bring yourself down. You could be taking tea with 7 teaspoons of sugar. You can get back from 7 to 1 or to 0, but it has to be gradual.
These are obviously self-driven issues. And how can regulation, or how can regulation assist in driving or changing behavior?
Well, I think they are self-driven, but the environment help potentiates that. Okay. You go to a health function and add on your tables, there's juice, there's sweets, there's no water. Okay. So how do you become enabled when you are put in an environment that does not help you stay on the right path?
Meetings at the Department of Health, what do you say? Before that, we believe Miriam is back on the line. Miriam, welcome to Health Talk.
Morning.
Morning, Miriam.
Yes, my concern is like where it's in the township, and then each and every corner of the street, you'll find the dumping site there, and then there are open tin fish there, there are open used condoms, and then you'll find kids playing there on the dumping site, and sometimes you'll find kids coming with the that open things there, and then they come and play houses in the yard with other kids, and they will come and play, taking those things from the dumping site and bringing to the house, and then that's my concern of the dumping site.
Excellent comment. I want to get Dr. Letlape to comment on this. She's bringing a very important subject, the environment and harm reduction.
Yes, it is an important aspect that she brings in. But one of the ironies and the tragedies of a democracy is that communities have become too government dependent. Because all those issues about dumping, it's the community that's dumping, not having cognizance of creating a safe environment for raising their own children. And they then want government intervention. There will be issues of municipal failure in terms of waste disposal. Right. But our communities have to take responsibility. Harm reduction is primarily about you taking responsibility for yourself, for the environment that you create, for your children, your neighbors, and your community.
Okay. I have to give you some time to respond to some of those comments.
Okay, yes. I think let me start by the comment around what we serve, or creating an enabling environment for healthy eating. We do create enabling environment in number of settings. We have identified the workplace as one of the settings, the ECD centers or ECD program, both center-based and non-center-based, and the school as environments where there should be enabling or be conducive for people to consume healthy food. I'll cite an example. We have developed a national guide for healthy meal provisioning in the workplace, because during meetings, like you say, or when there are any functions in the governmental departments, you will find that the number of foods that are served, you'll find the pap, samp, rice, potatoes, chicken, beef and so on,
unhealthy food,
and juices and so on, muffins and so on. So what we have done, we have given a guide to say this is what could be provided to say it's a healthy meal. For example, in our department, we have actually revised our catering policy, and no sugar sweetened beverages are allowed. We only have water as a dessert. And
lots of bread and cake.
We do not allow cakes. We just have breads and whole wheat or whole grain breads. Right. And then the other thing, we do not have like a whole lot. We only allow one starch and one meat and vegetables and fruits. Fruit is the only allowed dessert. But that is not only for the Department of Health. We have sensitize all the national government departments. We have rolled out training to all national government departments on these guidelines, and a number of government departments have taken an initiative as well to change their catering policies. We are now rolling the program to provinces. We have already started. And in the school environment, we are revising the operational guide for tuck shops, because you find that what is sold in the tuck shop is not good for the children. You find that this fizzy drink is sweets, Simba chips that you don't even know their names, all those type of things that are not healthy. There's very few nutrients in the type of food that are sold there. So we're also looking and ensuring that what is sold in the school tuck shop and what the vendors around the school premises are selling are also promoting health.
This is a very important subject, and unfortunately we don't have enough time for this. I'm sure we're going to invite you back again to talk about just this aspect for the entire show of nutrition. All right, time for another quick commercial break. When we come back, we continue our discussion on harm reduction, but this time looking at alcohol and substance abuse. Please stay with us.
If we're talking health, then let's talk seriously.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
MedShield Medical Scheme doesn't just cover you when you're ill. We'll help you stay well.
We make sure to be where news is happening, both locally and globally.
For the latest business news, stay with us.
From South Africa to the world, we've got all your latest sporting news.
Don't miss our weather updates every hour.
Stay tuned to News Today, Monday to Friday, from 3 to 5:30 p.m. here on SABC News.
Alcohol harm reduction supports goals of safer drinking, reduced drinking or abstinence from alcohol or other substances.
I think you should limit the way you drink alcohol.
I say I only drink when I know it's an occasion. So I'm not a drinker actually. And if I drink, I don't drink to get myself distracted from my goals and from my values, because some people drink for, how can I say, to have fun, but they go overboard. So I don't go overboard. I drink just to have some fun.
I think it should not be consumed on a daily basis or on weekends. It should be on special occasions, especially for students. There's no need for you to go partying each and every weekend.
In the spirit of getting high, most drug addicts have engaged in the trend of sharing needles and the threat of a massive spread of HIV, hepatitis B and C have fallen upon the country.
Regarding the Bluetooth Nyaope thing, I don't support it because it's one of the things that promote other spread of the diseases. Like HIV, for instance, and other blood-transmitted diseases. So that one is a no-no for me.
Bluetooth is so like ubrayam uyahlaba nje uhlaba inyamule mina nginalutho makahlaba uyenzani uyayibona ichika ukuthi yenzani uyebembe makabona ukuthi uyibambile uyobona ngalo ngegazi lithela uyabona igazi malithela uyenzani uyayithumela ngaphakathi kwamabhitsi manje ngoba mina nginalutho engiyalimala uphetha ama-alost uyenzani ungiphi igazi lelo sithi i-Bluetooth.
Chilling stuff indeed. All right. Thank you so much for staying with us. If you've just joined us, we're talking harm reduction. And with me in the Johannesburg studio is Dr. Khosile Tlape, co-founder and president of an organization called Africa Harm Reduction Alliance. And we're joined in our Cape Town studio by Sean Shelley. Sean is the manager of projects, policy, advocacy, and human rights from PWD, or People Who Use Drugs. And Sean is also with the Department of Family Medicine at the University of Pretoria, and also working at that PWD on TB and HIV Care, or TB and HIV Care Association. Sean, welcome to Health Talk.
Morning, and thank you for having me.
All right. Sean, before I speak to you, let's just take a call from Dumisani in Pretoria. Dumisani, welcome to Health Talk.
Good day, sir. How are you?
Good, how are you?
I'm very well. My concern is that I haven't seen health inspectors at schools to come and check the sellers that are selling food for our learners at school level, especially in townships.
Okay.
So I was just asking if maybe are they inspecting only restaurants and other premises than schools?
All right. Very good question. Thank you so much.
That are consuming food must be also inspected as well.
All right. Thank you very much for your question. Fortunately, the people from the representative from the Department of Health are still with us, and we will relay that question to them. But let's cross over to Cape Town and speak to Sean. Sean, in my introduction, I said you are with an organization called PWD, People Who Use Drugs, and you're obviously working on TB, HIV care. So please just tell us exactly what you do.
So I'm with an organization called TB HIV Care Association, which has been providing health services to marginalized communities way back since 1929, in fact. We're a fairly large a non-profit organization, and more recently we've been focusing our services on people who use drugs, and that's my area of expertise. I'm what's known as the drug person. My areas of interest are in harm reduction, specifically for people who use drugs that are labeled as illegal, but also across a wide range of services. And that's one of the impressive things about this morning's talks, is that we haven't limited it purely to HIV interventions and purely to the use of drugs, because harm reduction as a principle is something that can be applied across any human behavior.
There's been criticism leveled at people like you to say that perhaps this is an opportunity for you to clarify that and perhaps educate the public out there. People have said, but you guys are promoting the use of drugs by enabling these people to use drugs. How do you respond to that?
Yeah. Well, I say that firstly, we've got to be very pragmatic. The use of drugs is driven by a lot of factors. And the harms related to drugs are also related to a lot of factors. For some people, cannabis can be relatively benign. For others, it can be quite dangerous. The reasons why people might develop a problem with the drugs that they're using are very often related to their individual biology, or due to the fact that they're living in very suboptimal circumstances. And so the drugs that they're using become quite important to them. They fulfill a purpose. And so to simply expect people to stop is really unrealistic. We're going to find people using drugs in any society. And in fact, since the beginning of time, people have tried to alter the state of their mind. And for some people who are living in very marginalized circumstances, the use of drugs is quite important to them and serves a purpose. So unless we address those issues, we're not going to get a great reduction in drug use in our communities. And so what we really need to do is to help keep people alive and reduce the burden of disease on them. And what we found through our programs, which do include needle and syringe distribution, it includes opioid substitution therapy, which the doctor was talking about earlier, methadone, for example. We find that as people come into contact with the health services, they get their other health issues addressed. So, for example, in the middle of Tshwane, the city of Tshwane, we've got a group of street-dwelling, heroin-injecting, HIV-positive individuals who are virally suppressed. And that's virtually unheard of. And that's just because of harm reduction services. These people aren't going to die of HIV complications, and very importantly, they're not going to be spreading the virus. So these kinds of interventions have been shown internationally and over 40 years to reduce the levels of harms, not only to the individuals, but also to the community as a whole. And so they're essential.
And how are you received by people who use drugs? I mean, clearly there's issues of trust, and I mean, they're always on the run, away from the police, yes, and so on. And how are you received by them?
So one of my other roles is with the South African Network of People Who Use Drugs, and our Deputy Minister of Social Development, in her statement to the Commission on Narcotic Drugs last year, said that we need to involve people who actually use drugs in consultation. And for the first time in South Africa, the Central Drug Authority has done that in the development of the new National Drug Master Plan. And we, in a similar way, what we do is we employ peers, people who are former or current drug users, and they help us reach the individuals who are on the streets and who are injecting drugs and who are very difficult to reach and have those issues of trust because they're a highly criminalized population. And of course, that makes it very difficult for them to access health services. So we use peers a lot. And over time, we've developed a lot of trust with the communities, and that's one of the reasons why we have a lot of success. And interestingly, although we don't insist on people stopping using drugs, what we do see is they tend to reduce the harmful use of drugs. And for example, people in our project know that Bluetoothing, first of all, doesn't work, it doesn't give you a high, and second of all, it's exceptionally dangerous. And so they're carrying that message forward. And so we don't see it within the cohort of people we work with.
Mm-hmm. Let me invite comment from Dr. Letlape, and also around the issue of alcohol, because we've spent quite a bit of time talking about, the hard drugs.
I think the first thing is that what's important is we can't do anything without engaging the people that are affected. Mm-hmm. The second issue is that we got to look at the social determinants of what underpins those behaviors. Mm. And if you don't look at the social determinants, you're like at the bottom of the cliff. Mm. So all the other issues, people that have run away from home, people that could not afford to go to school, etc., people need to be given alternatives. Mm. So it needs to be approached holistically. Mm-hmm. But once people start doing Bluetooth, you need to educate them about the fact that you don't get much of a high anyway. And if they're going to continue that, you need to ensure that there are needle exchange programs, because it's getting us back to the era of where people are using needles and they can spread diseases that are spread through sharing of fluids. Mm-hmm. And that becomes important to do that. When it comes to drinking, we got to begin to look at what are the social patterns of drinking. I mean, in many parts of South Africa, you have binge drinking. Why do people drink? Can you change the habits of people? And it becomes an issue of educating people and saying, changing the goalposts. Don't drink to get drunk. If you're drinking just because you want to be in a lighter mood, set parameters for yourself. Set limits for yourself. Not beyond 2 glasses, etc., etc. Don't drink and drive. Remember, there are also other issues where drinking is related to domestic violence and other violent behaviors. So we have a social responsibility to deal with these issues in a systematic manner, going into what drives those behaviors. Yeah. People used to drink alcohol to celebrate. We use it either to celebrate or to deal with the depression. Yeah. So we use it every day. All those underlying social conditions need to be dealt with.
Okay. Sean, let me just give you the last 20 seconds or so, just to wrap up. Your final message to the public.
Final message to the public is that people who use drugs are people as well. They're a lot like you and I. And like the doctor was saying, there are a lot of social determinants. We need to include them in our communities and provide health services for them. Otherwise, the problem is only going to get worse and become a self-driving phenomenon.
Okay. Well, Sean Shelley, thank you so much for your contribution. Well, that's Sean Shelley, Manager, Projects, Policy Advocacy, Human Rights, PWD, or People Who Use Drugs, and also with the TB HIV Care Association. Okay, time for another quick break. When we come back, we now focus on harm reduction and smoking. Please stay with us.
If we're talking health, then let's talk seriously.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
MedShield, embracing our members in good health since 1968.
Cigarette smoking increases the risk of illnesses and early deaths for people with coronary heart disease. The best way to reduce these illnesses and deaths is to stop smoking.
Smoking is not good, and I don't smoke because my body is my temple, and I believe in looking after the temple. So, like, smoking is like causing a lot of diseases in the temple. So, for me, smoking is no good. I don't smoke, and if people do smoke, I think 1 to 2 is enough for a day.
A lot of people are resorting to these vapors, so I think they assist them to leave the actual cigarette and not get, lung cancer and all that comes with the cigarettes.
I heard it's addictive, but I think at least if one can take one, at most one a day, I think that one, at least it might not have that too much effect.
I don't see it necessary for one to smoke, though they say it helps them relieve stress and so forth. I don't think smoking is necessary.
Welcome back once again. We're talking harm reduction, and this time we're talking smoke. We're focusing on smoking. And with me in our Joburg studio, Dr. Khosile Tlape, co-founder and president of Africa Harm Reduction Alliance. And it's a pleasure to welcome Savera Khalidin, who is the executive director, National Council Against Smoking. Welcome to health.
Thank you.
Savera.
Thank you. Good morning.
All right, we heard in that short clip that we played now that, obviously smoking is harmful to health.
Yes.
Let's hear it from you.
Absolutely. It was interesting to see some of the myths, that people reported that one a day is not going to be harmful to them. The thing is, we need to know what's in cigarettes. We have over 70 cancer-causing chemicals in cigarettes. Whether you smoke 1 cigarette or you smoke 100 cigarettes a day, you're still inhaling those chemicals. And they're things like ammonia, toilet cleaner, exhaust fumes, rat poison, which ordinarily we wouldn't put into our bodies. So those are the things that are causing the harm that leads to lung disease, heart disease, impotence, all of these kinds of things. And one of the people you spoke to said it's better to move to e-cigarettes. E-cigarettes also have nicotine. They also have cancer-causing chemicals in them, and the only difference, although the amount of nicotine is less in the e-cigarettes, therefore the harm is reduced. But with the evidence we already have, what we know is that the location of lung cancer moves from the top of the lung to the bottom of the lung when you use e-cigarettes, because you have to inhale more deeply to get the same effect because it has less nicotine. So the message for us, the harm reduction message for us, is that no nicotine is safe, no cigarette is safe, whether e-cigarettes or whether the combustible cigarettes that we know. That is the message from WHO, and that is also the message that the Department of Health is promoting, because there is already evidence. Of course, with e-cigarettes, there is a little bit of controversy because different health organizations have come up with different kinds of evidence. But the challenge with e-cigarettes is they haven't been around long enough. So we haven't had the same long 20, 30-year use where we can show conclusively what the harm is. But for us, definitely, we would say, if you want to use e-cigarettes, you should not be using ordinary cigarettes at the same time. And the evidence we have for South Africa is that people are using both, that they're not actually stopping cigarettes and moving to e-cigarettes, but they're using them interchangeably.
Okay, I'm going to ask Dr. Letlape just now for his comment, but before I do, let me just get obviously you are National Council against smoking.
Yes.
You discourage people from smoking.
Yes.
I would imagine you help people stop smoking.
We do.
How do you actually do that? And what's your success rate, if I can put it like that?
Okay, so the success rate with quitting is about 30% of people who try to give up will find it easier to give up if they have counseling, as well as participate in some kind of support group and use a nicotine patch or something, that if they try to do it on their own, that it's way harder to do. And the reason it's harder to do is because nicotine is addictive. Okay, once you start using it, your brain starts asking for it all the time. And although it's an unnatural need, it becomes a need, like food or water or any other pleasure. We run a quit line, which is 011-720-3145, where people call in, we send them material, we give them some of the strategies. For example, you have to decide on a date to quit. You have to inform your family and friends because you'll need their support. You have to decide what your substitute healthy behavior is going to be.
So all of these are outlined there.
Yes.
I'm afraid I'm going to hurry this a bit because we're running out of time.
Sure.
And there's important stuff that I'd like covered in here. I don't want you to spend too much time on whether or not nicotine is harmful and all of that, but please just a quick comment on what National Council Against Smoking is saying and what the alternatives are, because we accept that there are people who struggle to stop.
In smoking cessation clinics all over the world, smokers that can't quit are offered nicotine replacement therapy. And it's a medical intervention that is acceptable. If nicotine was harmful, we as doctors would not come up with a therapy that gave people nicotine, just to construct things properly. And we've always known since the 70s that people are addicted to the nicotine but are killed by the tar.
Okay, so you spoke about...
That's a well-known fact.
Okay.
And there should be no confusion about the harm caused by combustible cigarettes. As she has said, it produces upwards of 7,000 chemicals. There have been 92 that have been identified as carcinogens. Now, when you do not combust it, you see, people have to focus on the fact that despite all our interventions globally, there's still 1 billion people that continue to smoke, knowing the dangers of smoking. And the question is, what can we offer them? Those
and what is there? Because we have about a minute left.
And
so
what is there is alternatives to combustion.
All right.
She spoke about e-cigarettes. There's also what is called snus, which is moist snuff in pouches, which looks like that. And lately, what is now coming up is nicotine in pouches, where there's absolutely no tobacco. That's tobacco, that's no tobacco. And something that is coming up now is electronic devices like this for heating the tobacco, not burning it. And there are studies about less chemicals being produced. Now, here's an article about that, snus. World Health Organization report of 2012 on mortality has shown that Sweden, which has taken to snus since the 70s, the only country in the EU where snus is not banned, has seen the benefits after 30 years of snus. They have the lowest mortality attributable to tobacco. They have less. The average for Europe is twice the number of deaths, and some countries are at more than 4 times. Okay. So it's been shown. This is the only. And when snus was introduced in the 70s, the same debate that we have about electronic cigarettes was there. As a result, it was banned in the EU countries. And they have not had the benefit of harm reduction.
This is a very important subject. And we always run out of time when we're talking about smoking.
We need the whole hour.
Unfortunately, this is it. That was Dr. Khosile Tlhape, co-founder and president of Africa Harm Reduction Alliance, and with him is Savira
Khalidin.
Okay, Savira Khalidin, Executive Director, National Council Against Smoking.
So
that's all we had for you for today. Unfortunately, we've run out of time. Until next week, same time on SABC, please do take care. Sorry.